Hey, so this is actually going to be a pretty quick one because I have to get in there. But just a quick note on triage and waiting at the ER. So triage is a very fancy French term for basically assessing the situation and figuring out where on the priority scale clients, patients, situations are and addressing them as such. For example, a torn nail on a dog that is not actively bleeding is going to fall lower on the priority scale of attention compared to a hit by car that is having trouble breathing. It doesn't mean that the nail is not important. It just means that if we don't do something soon, the dog that was hit by a car is going to suffer a lot more medical issues than the nail is by waiting for a little bit longer. Now, waits at ERs, especially depending on where you're located, can vary. It really depends on who's there, who's coming in, and what sort of events are happening and where you fall on that triage scale. Do prepare when you go to an ER. You could be seen either immediately or it could be quite a few hours. I know we never really plan for emergencies. That's why they're called emergencies. But have a book, have a charger, maybe have a snack in your car with some water just in case, because if you are the pet parent of a dog with a torn nail and there are multiple other cases ahead of yours that are higher on the triage scale, then you are going to be waiting for a little bit. And you may think that, but it's just a torn nail. It would be so quick and easy just to get it done and dealt with and get out of here. And it would, but there are limited hands, there are limited attentions, and sometimes there are things much, much more critical that need to be seen and dealt with first, despite, a torn nail being a fairly easy and quick thing to deal with on the regular. So just please understand that if you're waiting, that is one of the best things ever, especially in an ER. It means that your pet is stable. It means that your pet can wait to be seen. It means that there is nothing life-threatening going on right that very moment. You will be seen. It may just take a little bit of time, and we will be with you, and we will certainly give you the best care possible. It just might be a while. And if you have questions about how long it's going to be, certainly you can ask the front desk staff, who will talk with the behind the scenes crew and determine how long it might be. Again, it's just a guesstimate, but we can sort of gauge how long it might be. And, just have peace and confidence that it's a good thing that you're waiting. All right, so I do have to get in there, but I will see you later, and please take that knowledge with you. Hopefully you won't have to go to the ER anytime soon, but if you do, waiting is a good thing. All right, have a good rest of the night. Talk to you later. Bye.